In this video, we're going to cover key things that you need to know about liver cancer, including causes, as well as possible signs and symptoms, and all of the following sections are time-stamped and split into chapters. So liver cancer is a cancer that's found anywhere in the liver, which is the large organ at the top right side of your tummy. The liver helps you to digest your food as well as remove toxins. Now, liver cancer can sometimes start in your liver, in which case it's referred to as a primary liver cancer, or it can spread to the liver from another organ that has cancer, such as the skin, in which case it's referred to as secondary liver cancer. Now, how serious liver cancer is depends on where it is in the liver, how big it is, whether or not it's spread, if it's primary or secondary, as well as your general health. So now let's discuss some potential symptoms and signs of liver cancer. Well, liver cancer may not have any symptoms, or they may be hard to spot, but if you notice any of the following, then you should speak to your health provider. So the whites of your eyes turning yellow, or your skin turning yellow, which may be less obvious on brown or black skin, this is known as jaundice. You may also have itchy skin, darker pee, and paler poo than usual. If you notice loss of appetite or losing weight without trying to, especially if you lose more than 5% of your normal weight over 6 to 12 months, if you're feeling excessively tired or have no energy, or if you notice a lump in the right side of your tummy. Now, other symptoms of liver cancer can also affect your digestion, and these can include feeling or being sick persistently, pain at the top right side of your tummy or in your right shoulder, symptoms of indigestion such as feeling full very quickly when eating, and a very swollen tummy that's not related to when you eat. Now, it's really important to note that these signs and symptoms can be caused by other issues with the liver or other parts of the body and are not necessarily specific for liver cancer. Just because you have these signs or symptoms does not necessarily mean you have liver cancer, but it's always best to speak to and see your doctor if you do, so they can take a full history, do a clinical examination, and order further tests if needed. If your symptoms are being caused by cancer, finding it early may mean it's easier to treat. Now, to help you, Cancer Research UK have very helpfully put together some top tips for things that you might want to write down to help you remember what to say when you go see your doctor, so that you can make the most out of your appointment, and I've included these on screen now and also put them in the description box of the video. So now let's briefly discuss some of the potential causes of liver cancer. Well, anyone can get primary liver cancer, and it's not always clear what causes it. However, you may be more likely to get it if you're over 60, and it's most common in people over 85, if you're a man, if you have certain medical conditions such as hepatitis, liver cirrhosis, gallstones, diabetes, a parasite in the liver known as liver flukes, or HIV, if you have a brother, sister, or parent who had primary liver cancer, or if you've got cancer in another part of the body, this could potentially cause a secondary liver cancer where the cancer cells spread to the liver. Now, many liver cancers are also linked to your lifestyle, such as heavy alcohol intake or smoking. Now, whilst you can't always prevent liver cancer, there are some things that you could try do. These include trying to lose weight if you're overweight, wearing protective clothes and masks if you work in a job where you're exposed to harmful chemicals, trying to avoid drinking more than 14 units of alcohol a week, as well as trying to quit smoking if you smoke. Now, if your doctor suspects that you might have liver cancer, they will want to organise some tests to investigate things further, and they may refer you to a specialist at the hospital. Now, the tests can include things like blood tests, scans like an ultrasound scan, a CT scan, an MRI. Now, if you're seen by a specialist at the hospital, they may also collect a small sample of cells from the liver, which is called a biopsy, to be checked for cancer. Now, you may not have all of these tests, and if you've already had another kind of cancer and the specialist thinks it might have spread to your liver, so secondary liver cancer, you may also have a PET scan. Now, these tests can help find problems in your bile duct, the pancreas, or the gallbladder. In terms of treatment, well, treatment will depend on a variety of factors and will be individualised, and so I won't go into detail about this in this video, but I have included some useful resources and links to the NHS website, Cancer Research UK, as well as the Cleveland Clinic website, which outline general treatment options which can range from surgery, chemotherapy, using heat to destroy the cancer known as thermal ablation, targeted medicines, as well as radiotherapy. Now, these websites contain much more information on these, and specific treatments are going to depend on the size and type of liver cancer, the location, whether it's spread, as well as your general health, amongst other things. Please leave a comment if you've got any questions or want to share your own experiences or general thoughts to help others, and thanks for watching.